In this video, we'll be analyzing the movements of throwing a javelin. The javelin throw requires the body's muscles to produce force in the movements to increase the distance of the throw. The movements of the javelin throw are created by the ability of the body's connecting joints and muscles working together to produce the force and energy to be transferred into the connecting body segments to use the force created. The anatomy that is used in creating these movements include the bony structures, ligamentous, musculotendinosus, and the joint types of the body. The anatomy that we are focusing on is the wrist, the elbow, shoulder, pelvis, knee, and the ankle. The bony structures of the wrist consist of the 8 carpal bones: the trapezoid, trapezium, scaphoid, capitate, hamate, pisiform, trochlearum, and lunate, and also consists of the radius and ulna. The radius and ulna connect into the elbow joint, which also consists of the humerus. The humerus connects the elbow into the glenoid fossa of the shoulder, creating the joint. The main bones of the shoulder include the humerus, scapula, clavicle, and the sternum. The main bony structures of the pelvis include the sacrum, coccyx, ilium, ischium, pubis, greater trochanter, lesser trochanter, and the femur. The femur connects into the knee joint. The knee joint consists of the femur, the medial and lateral epicondyles and condyles, the patella, tibial tuberosity, Gerdy's tubercle, and the tibia and fibula. The tibia and fibula then connect into the ankle and foot. The bony structures in the ankle and foot consist of the phalanges, metatarsals, the 3 cuneiforms, medial, intermediate, and lateral, the cuboid, navicular, talus, and the calcaneus. In addition to the bony structures, there is the ligamentous. The main ligaments of the wrist consist of the radial-collateral ligament, ulnar collateral ligament, palmar radiocarpal ligament, and the ligaments connecting the carpal bones, such as the scapulolunate ligament. The elbow consists of the ulnar collateral ligament, radial collateral ligament, annular ligament of the radius, and the quadrate ligament. The ligaments of the shoulder consist of the glenohumeral ligament, coracoclavicular ligaments, coracoacromial ligament, and the transverse humeral ligament. The hip has 4 main ligaments: the iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament, and the round ligament that connects the head of the femur to the pelvis. In the knee, there is 5 main ligaments: the patellar ligament, the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral ligament, and the lateral collateral ligament. Also in the knee, there is the meniscus, which is not a ligament, but is a stabilizer and a shock absorber of the knee. The ligaments of the ankle consist of the deltoid ligament, the calcaneofibular ligament, the posterior inferior tibiofibular ligament, posterior talofibular ligament, anterior inferior tibiofibular ligament, and the anterior talofibular ligament. And on the base of the foot, there is the plantar fascia. In addition to the ligamentous, there is the muscular tendinosus. The muscles of the forearm into the wrist consist of the flexor carpi radialis, the palmaris longus, flexor carpi ulnaris, pronator teres, the anconeus, the extensor digiti minimi, extensor carpi ulnaris, the extensor indicus, the extensor carpi radialis longus and brevis, the abductor pollicus longus, the extensor pollicus longus and brevis, and the extensor digitorum. Moving up the arm, there's the brachioradialis, the brachialis, the tricep brachii, the bicep brachii, the deltoid, and moving towards the shoulder, there's the supraspinatus, the infraspinatus, teres major, and the subscapularis. Connecting to the shoulder joint is the pectoralis major and the latissimus dorsi. Moving to the lower extremities of the body, there are 4 main muscle groups in the upper leg: the abductors, the glutes, the quads, and the hamstrings. The abductor group consists of the pectineus, the abductor longus and brevis, the abductor magnus, and the gracilis. The gluteus group consists of the gluteus maximus, minimus, and medius. The next group is the quadricep group, also known as the quads, which consists of the vastus lateralis, the vastus intermedius, the vastus medialis, and the rectus femoris. The muscles of the hamstring group consist of the semitendinosus, semimembranosus, and the bicep femoris. Moving down the leg, at the back of the knee, there are two muscles, the popliteus and the plantaris. The muscles of the lower leg consist of the gastrocnemius, soleus, peroneus longus, brevis, and tertius, the tibialis anterior and posterior, the extensor digitorum longus, extensor hallucis longus, flexor digitorum longus, and the flexor hallucis longus. The joints that we are focusing on is the wrist, which is a condyloid joint, the elbow, which is a hinge joint, the shoulder, which is a ball and socket joint, the pelvis, also known as the hip, is also a ball and socket joint, the knee, which is a hinge joint, and the ankle, which is a hinge type joint. The anatomy of the body makes it possible for our body to produce the phases of the movements of the javelin throw.
During the first phase of throwing, the initial stance, the right wrist is in ulnar deviation and supination. The right elbow is an extension. The right shoulder is in external rotation and horizontal abduction. The left wrist is in neutral and in pronation. The left elbow is an extension, and the left shoulder is in abduction. At the hips, there's lateral pelvic tilt and slight flexion. Starting on the right side, the right knee is an extension, and the right ankle is neutral and relaxed. On the left, the knee is in flexion, and the ankle is in plantar flexion. Transitioning into the cocking phase, the right wrist is in extension and supination, the right elbow is in flexion, and the right shoulder is in horizontal abduction and external rotation. On the left side, the wrist is in a neutral, pronated position. The left elbow is an extension, and the shoulder is in horizontal abduction. At the hips, there's flexion and lateral tilt. On the right side, the knee is in flexion and slight internal rotation. At the ankle, there's slight plantar flexion. On the left leg, the knee is in extension, and the ankle is in dorsiflexion. From the cocking phase, the next phase is the release. At the right wrist, there's flexion, pronation, and radial deviation. At the elbow, there's extension, and at the right shoulder, there's horizontal adduction and internal rotation. On the left side at the wrist, it's in a neutral position. The left elbow is an extension, and the left shoulder is in flexion with internal rotation. At the hips, the right hip is slightly extended, and the left is in flexion. The right knee is in extension, and the right ankle is in plantar flexion. The left knee is in extension, and the left ankle has weak plantar flexion. After the release of the javelin, the thrower goes into the follow-through phase. Starting at the wrists, both wrists are pronated and neutral. Elbows are in flexion, and the shoulders are adducted. The hips are in weak flexion. Both knees are in extension, and both ankles are in plantar flexion.